What do medical laboratory technicians do, and what qualifies me to tell you what they do? First of all, I have underwear older than some of the people who train me at the labs that I've worked at. They've been there like 6 months. Here's actually one of my managers who just graduated from kindergarten. And she reminded me that I told her that I could draw blood in my interview. So she's going to send me out to draw blood since none of the younger people can draw blood. So I get to go work with Benita, who's been there since she got out of junior high. She's been drawing blood for 40 years, and she has a lot of questions for me about my political affiliation and my home life. She wants to make sure I'm going to be, oh, yeah, and she handles urines with no gloves. So if it bothers you that people do not wear gloves when they're handling body fluids, especially stool and urine, the laboratory might not be the place for you because there's a lot of people who do not wear gloves and it's disgusting. Okay. Oh, here's Joanne. Joanne is patiently waiting to pounce on you and talk to you for about 45 minutes until you pass out or feel lightheaded. She has a lot to say to you. She doesn't really care about anything you have to say. Here's some specimens that aren't even labeled. Supposed to be serum in there, but it's clearly blood. Has not been centrifuged and aliquoted yet. Here is some reagents that you're going to need to check because the shift before you will not bother to check to make sure you have enough reagent for your shift. They're not going to make sure if it's going to expire or not. So you're going to want to check on your own to make sure there's plenty of reagent in your chemistry analyzer for your shift. And you're going to have to watch people that clearly have no idea what they're doing, and you're just going to leave them alone. Like this guy's just squirting stuff wherever. Here's another chemistry analyzer. Don't break the probe. Your main job is to not crash the probe. You're going to also aliquot lots of urine into small little vials. There's a lot of pouring big cups of pee into little cups of pee. So here's some more little vials of urine for you to walk around the lab. Don't run. Here's another chemistry analyzer. They're really, really loud, which is kind of good because then you don't really have to hear Joanne talking very much. Here's the guy who decides he's going to just sniff the tray first to see if it needs replaced or a new pad in it. I would just go ahead and put a new pad. Here we have a group of people watching the board waiting to see if the patient who's getting lactics every half hour is going to be released. Yes, they're leaving the hospital for another hospital. Thank goodness. That patient is going home. Here's Susan, and Susan loves her instrument. It's the same instrument that she's been on for 30 years since she got out of high school. She's not going to show you how to operate her instrument. It will. Oh, here's another chemistry analyzer. Got to go do some quality control on it. Don't stick your hands in there because those robots do not care. Oh, there's Susan again. Once again, she's not going to tell you how to do her job. She fears change, and she fears that someone's going to take her job if someone else knows how to do it. They would be mad if they knew how easy her job was, that she swears takes 4 weeks to learn. If she would just leave, it would take you half a day to learn it. Normally you pour big cups of pee into little cups of pee, but here's somebody pouring little tubes of pee into a big cup of pee just to switch it up a little bit. We're going to add some red reagent of some sort to it just to get spicy. Oh, don't expect to have any personal space in the laboratory. People will breathe down your neck behind you and very close quarters. Here we're going to maybe add some, I don't know, sulfuric acid or something like that. Some SSA to maybe we're going to see if it's positive for protein or something. Lots of urines. That's one thing to take away if you take away nothing. Okay, so here's a weird guy that works in the micro department. I would recommend just leaving him alone. Let him do his thing. If as long as he's doing his thing, you don't have to worry about micro. So just let him be weird in the back by himself. Yeah, so just wave and be on. Bye. Here is the annoying assistant that works on third shift, does nothing but play with his phone and giggle. I actually quit my job because of this guy. One of my many jobs. I've worked in over 12 labs. I get very annoyed at people who are not working and acting goofy instead, especially playing with their dirty hands on their phones. That's just nasty. There's a lot of just standing around and talking in the lab, and that's mainly because the instruments and the computers do most of our work for us. So there's a lot of just talking about nothing, maybe grandkids or family reunions or gardening, games, just sort of maybe they're playing Sudoku or something like that. But there is room for everyone to come work in the laboratory. You don't have to be certified. You don't have to have any education past high school. So yeah, come work in the lab. Oh, and you're going to have to go out and draw blood again. If you went to a school that was decent and they taught you how to draw blood, you're going to be expected to do that. And don't worry if the young people haven't. They just apparently just don't have to. The nurses are now drawing blood. Apparently the nurses don't have enough to do, so they're going to draw blood, and I guess the laboratory is not helping them anymore. We're just playing with our plates, even though most of bacteriology, microbiology, virology has moved to molecular. And if you are going to be plating anything, please do it under a hood. A lot of times what you're opening up is going to stink. The main reason that we use hoods in the hospital laboratory is because this poop stinks. Don't open it up out on the bench. Here's someone opening another cup of pee, pouring it into a small cup of pee. You can have a lot of that if that bothers you, if stool bothers you. Lab tech is not what you're going to want to do because we do lots of tests for stool in the hospital laboratory. We're checking for blood, checking for white cells, maybe checking for some C. diff. Maybe we're going to plate it, see if there's any pathogens that don't belong in there. And you're going to maybe add the poop to some solution and shake it up, get real shaky. Maybe check for C. diff. Once again, if you're going to plate something, please do it under a hood. That urine's probably stinky. That's probably why it needs culture, bacterial culture. We're going to look at some stuff under a microscope. Maybe we're looking to see at the cells, like right here. Behind me, we've got all sorts of cells, red cells. We're going to judge it. It's like a beauty pageant for cells in the body. And we're going to decide which ones look normal and which ones look abnormal. Maybe there's a band in there somewhere. I don't know. There's a mono, another mono. Oh, that looks like a band. It could be a mono back there, but I don't see any bands. Oh, and there's one of the nurses that is now drawing the blood that the lab used to draw. Apparently, nursing just didn't have enough to do. So they're taking that upon them as well. Sorry, nurses, but, we're busy talking. The blood transfusions is something that you'll help prepare for. You'll help match up the patient with a proper donor type, and you'll match up the blood with patient serum and donor red cells. Everything's barcoded. The bands on the patients are barcoded. It's really hard to kill somebody these days. It's like you have to try to give them the wrong blood. So don't worry about it. Just make sure you initial everything. Document everything. Make sure you double check your work. Your manager's going to double check your work for you, and they'll be mad if you didn't put your name, date, initials, and everything else on there. Any questions, let me know. Thanks for joining.